all things hormones, all things men's hormone. That's right, on this episode of All Things Women's Health. I'm an obstetrician gynecologist of some 30 years. I'm a husband, I'm a father, I'm a grandfather, a small business owner, I'm a Catholic, I'm a lot of things. But right now, I'm your host as we talk about really all things women's health. And it doesn't matter if it's from infertility to childbirth options, from menstrual problems to mammograms, homeschooling curriculums to personal trainers. If it affects women and their health, it's on our agenda. And our agenda in this episode includes men's health, men's hormones to be specific. And joining me for this episode is my good friend and my partner in practice, Dr. Jeffrey Cly. Now, like me, Dr. Cly is an obstetrician gynecologist, but he's pursued additional specialty training in hormones, and more specifically for this episode, in men's hormones. Well, Dr. Jeff Cly, welcome to the show.
Thank you. Yeah, happy to be here.
It's good to have you here to talk about men's hormones. As we said in the intro, we even talk about men's hormones because it affects women's health, doesn't it?
Absolutely.
Or at least their happiness or unhappiness in life.
Yeah. Absolutely.
Right about now, I think our viewers, the female viewers are watching this thinking, somebody is finally talking about men's hormones. So now I'm going to understand my husband.
So many times they come in and they say, man, this sounds like my husband with low testosterone, low thyroid. What can I do? I say, well, we take care of men too. And that's the women drive the healthcare in the family. So they usually kind of bring their husbands in, which helps a lot.
Well, let's kick off with a discussion, I guess, on when we say men's hormones. Let's be clear, what do we mean when we say men's hormones? I think everybody thinks testosterone, but let's talk, what do we mean when we say men's hormones?
Testosterone certainly is the number one thing or hormone for men, but thyroid hormone comes into play very frequently.
Sure, but those are going to be the two big ones.
Two big ones.
Yeah.
And then as we're looking into the hormones, estrogen and the ratio of testosterone to estrogen comes into play.
Yeah.
Vitamin D levels, vitamin B levels. Those are probably the more common things that we see or can make a difference in.
I feel like we should probably pause because you said estrogen and we're talking about men. Right? So ladies, men have estrogen also. Now, men don't have ovaries. So where does their estrogen come from?
In the men?
Yeah.
Well, the testosterone breaks down into estrogen by our bodies. And so men have to have a level of estrogen.
Yeah.
And so we have to have a level that's appropriate, which is about 3 to 5% of the testosterone level.
Should be estrogen.
Estrogen, 3 to 5%. So if we have more than 5% estrogen breakdown, and some men actually, especially with obesity, have a conversion of their cholesterol into estrogen from the fatty tissue. So what that does is causes issues and mood changes.
Sure.
And
so the ratio matters. The totals matter and the ratios matter.
Yeah.
So we're talking about, you said testosterone and thyroid hormones as well. If we move on into that and think, how do we know if a man has low testosterone, if we think about testosterone first?
Yeah, so some of the symptoms of low testosterone are weight gain, low libido, lack of motivation, irritability, impatience, anxiety, depression, or worsening of anxiety, depression, decreased erections, softened erections, decreased morning erections, which is something that us men have since puberty. And it's a natural...
And it's actually a sign of health.
It's a sign of health, and it's a natural hormonal reflection of how your body's working.
Right.
So as your testosterone goes down, that's one of the things I hear a lot of women patients say, yeah, I've noticed my husband doesn't have those as much. So that's a very common tip-off. So those things make a big difference in how a man functions.
Yeah.
And a lot of guys just don't know where to go or what to do to find out.
So in that long list of possible symptoms of low testosterone, is there one that you think, when you're seeing men, that's the most clear evidence that there's low testosterone?
I would say thyroid and testosterone fatigue.
Fatigue.
The fatigue is a very common thing. along with just feeling like they don't have stamina. Like when they're working, example, during the day, they're getting tired where they didn't used to.
Oh, okay.
They're coming home from a job, maybe they're doing construction, and they're wiped out at the end of the day.
Oh,
Yeah, they may work out and can't build any muscle. So a lot of guys just feel wiped out.
just not right.
Not right. And then the libido comes into play second, but the leading thing is a guy saying, man, I just don't feel like I used to feel.
Just general energy and fatigue. Well, then what about thyroid function? What's the list of things that would be examples of low thyroid?
The thyroid it goes hand in hand with the testosterone, but low thyroid would be weight gain, fatigue also, tiredness, lethargy, can't lose weight, dry skin, constipation. Those are the common things. So when we check a man's thyroid, we frequently find there's other things like vitamin D, vitamin B. When we check their testosterone, we check a thyroid and those other levels. And frequently people might be suboptimal on their thyroid. And maybe it's not true classic hypothyroid in the danger zone, but it's suboptimal or low enough where it affects their day-to-day.
Yeah. We've talked a little bit on another episode when our two nurse practitioners joined us. We talked a little bit about thyroid, but it's probably worth revisiting that. A lot of people know of the TSH test, and a lot of times they will have gone maybe to their primary care physician complaining maybe of fatigue or weight gain or something. They check a TSH, and it's in the range that's listed as normal on the lab.
Yeah.
But what you're just talking about is that's not always enough. So describe how you're thinking about thyroid in terms of all of the tests.
I started learning about thyroid years ago when family members had some issues. And that's when I realized that we're not taught in med school how to optimize thyroid. We're only taught if the lab values are normal or abnormal from the lab range.
Right.
And if it's inside the lab range, we are taught, oh, it's fine.
Right.
But people don't feel fine when it's on the one side or the other side of optimal. And optimal is right in the middle.
And it seems worth pointing out for any lab, not just thyroids, but for any lab, there's that range that's printed as normal. And that just means they've taken a large number of people and come up with a mathematical average. That doesn't mean it's right for you. And one person might feel fine at a level and another person feel horrible at that same level.
Right, correct. It's everybody's different. Most people find optimal, let's say, is 1 on the TSH range of 1. It goes from 0.5 to 5 on the lab range. And so if you've been at 1 most of your life and all of a sudden you've moved to a TSH of 2, and I'll explain that in a second, your body is struggling because you're not producing enough. And so the TSH is an indicator test. And the analogy I use is imagine you're in class and you want to answer a question from the teacher. The more desire you want to answer that question, you raise your hand higher and higher and higher until you're saying, teacher, teacher, teacher. Which the TSH is like that. The higher it's going, the lower it is in your body. And your brain is raising its hand, asking for more. I need more thyroid. I need more thyroid. So it's a flag on how much your brain needs. So when the TSH is going lower, your brain is saying, oh, I'm okay. I'm okay. I'm okay. So that's where it's an inverse relationship.
Yeah. Low thyroid function is a high TSH,
Right.
and vice versa. That gets complicated. So TSH is one. What about the other components of a complete thyroid assessment?
The TSH is your main indicator, and we check all of them, the T4, the T3, the free T3, the reverse T3. And so those get a little more complicated, but what they do is that's the actual circulating levels of thyroid that are working day to day.
Yeah.
And so we look at all of those to optimize those, because if you're suboptimal or you're in the low normal lab range, you may not feel that good. So if we add some thyroid hormone, I prefer the natural thyroid hormone, which is from animals, but it works really well. It's been around for 30, 40 years.
That would be the Armor or the NP thyroid.
Right.
Yeah.
And then we add a little bit. A lot of people find that just that little bit of they didn't feel right, they finally feel good again.
Interesting.
They finally have the energy. They're not having brain fog, tiredness, fatigue. So it can change a person's life with just a little bit.
Yeah. So when we talk about the test titles or names. There's the TSH, there's the T3 and the T4, and then that goofy one called reverse T3.
Mhm.
We check all of those.
In the free T3.
Yeah,
free-
I know.
free
I'm sure you've
T4.
had the same experience, but I've seen patients and I'll say, I think your thyroid might be off. And they will say, no, my TSH was normal, but that's only part of the story.
Right.
We got to dig a little further to find out.
Right. I always say, well, what was it? And they say, my family doc or my other doc said it was fine. I go, give me that number.
Yeah,
And just the other day, I heard one, it's 3.5.
right.
And I showed her, I looked back, we had some records from years ago. She used to be at 1.6.
Sure.
So in her body,
Dramatic difference.
dramatic difference. And for her, she actually started crying because she felt justified because she's been feeling so lousy
Yeah.
for so many years and was told, you're fine.
Yeah. With women, it's been said, and I think proven, that often depression masks thyroid disease. But what I mean by that is it looks as though the woman is depressed. She's saying depressed things, but in reality, it's her thyroid. Do you find there's any difference in men?
Yeah, men, it's going to be they're more irritable. They don't want to do as many things.
Sure.
They would rather just sit on the couch when they get home. They are taking naps. They're not waking up on their own as easily.
Sure.
Not sleeping as well.
Oh, good. So that's testosterone, that's thyroid, and then let's say a little bit about vitamin D.
Vitamin D overlaps with testosterone.
Mm.
A lot of things overlap. I have a slide we can pull up
Yeah.
here. So vitamin D deficiency is usually when it's less than about 30. It goes from 30 to about 100 on the bloodstream. And so when you're deficient in vitamin D, you're going to have similar symptoms as with thyroid and low testosterone. Weight gain, mood swings, blood pressure challenges, fatigue, digestive problems, possibly extra sweating, dry skin, joint pain. And so if we check that, and that's easy to add,
Right.
that's a supplement. We need 800 roughly a day. Usually when we're going to supplement someone, we usually give them about 5,000 IU a day for absorption. And that's the standard dose you can pick up at the vitamin store.
So any of those symptoms that you described, they could be pointing to vitamin D deficiency, but there's a big overlap with the testosterone and the thyroid symptoms. So you've got to check them all.
And it seems like it's not just one. It sure seems like frequently it's a little bit of 2 or 3 of them.
You know, it seems like every other month, at least for a while, there was something coming out about vitamin D. It looked like the cure-all, then it looked like it was no good. Then it looked like the cure-all again. Any ideas why that's so controversial? I've never understood. It's just vitamin D. There's no harm to taking it. Why has the medical industry been so back and forth on whether it ought to be taken?
I was doing some research on looking at kind of these types of things, and what I've realized and found is we're taught how to treat disease in med school. We're not taught wellness. Like we're not taught to keep people well. We're taught if someone's having a medical problem,
Here's how you fix it.
Here's how you fix it. And so the medical community has never been on the cutting edge of how do you stay healthy.
Yeah.
We're not that good at it unless we've sought out extra training.
Sure.
So I think that's part of it. And then we have egos in the medical world. And so
But present company excluded, of
right,
course.
of course. It seems like anytime we don't have the answer, we kind of put it down like, no. We're doctors. We know better. And I think there's something in that realm is why that happens.
And, you know, I've always thought cynically a little too, vitamin D is cheap.
Mhm.
There's nobody's making money on vitamin D. And so it's not flashy. Nobody's advertising for vitamin D, but yet it sure seems to be critical.
Absolutely.
With fatigue, fertility, from a female fertility standpoint, it can affect ovulation health, all sorts of things when it's low. So it should most definitely be on this list of things that we're checking for men and for women.
Absolutely.
Well, so I mean, let's move on in our hormone journey, focusing a little bit on testosterone. Now, it's very controversial. Why? I guess maybe we should say what the controversy is, and then we should try to figure out why. But just like so many of the other hormone things, I've seen men, I've seen women where they say, "Nope, my doctor said the level was normal." Help us with that.
So it's interesting. It is controversial, and I wonder, is it partly because we're trying to optimize a way a man feels? We're We're not necessarily fixing a new medical problem. We're trying to optimize what happens over time, or what's happening to us because of our environment, our foods, the big companies who produce the foods that have so many chemicals in them, and that affects us. So we're fighting an uphill battle from the powers that be, but people just don't feel good. Men don't feel good, and for the last 20 some years, the rates of testosterone levels in men are decreasing more than they used to.
I think we have a slide on that, I believe.
So this slide shows that at age 25, a man's testosterone should be at 100% of where it's ever going to be naturally in life. And then 10 years go by, it's down to 70 to 75%. Age 40, it's 65% to 70.
Wow.
45, it's going down. At 50, age 50, your testosterone naturally declines to about 55 to 60% of what it once
At
was.
25. Wow.
Yeah. And so it just keeps going down. And I think in the past, we accepted that as
Right.
people. But now with modern medicine and the life that's so busy for so long, we were functional until our 70s, 80s. People have said, why accept feeling like the way I feel? I don't
Right.
want to feel this way. And so another very interesting slide for me, I want to show everyone is, when does a man start feeling like he has low testosterone and feeling the symptoms of low libido, low motivation, weight gain,
All those
irritability,
things.
yeah, and low muscle tone, can't build muscle. And that's when he gets to about a level of less than 500.
Wow.
And so in that slide, it shows that most men hit that level in their 40s and beyond.
And then from the data that I've looked at on most labs, that so-called normal level, continuing with that conversation we had earlier, goes down to the 200s.
Right.
And it will still be in the normal range. It won't be flagged as abnormal on your lab report.
Right.
But you're saying most men will start feeling something if they get to 500 or below.
Absolutely. That's when they start feeling the symptoms of low testosterone.
Yeah, so it would be critical for men to understand that. So if they get their testosterone checked and it's 375 and their provider says, nope, it's not testosterone, your number is normal, that may not be the case.
Right. It is absolutely testosterone. Their number is normal by the lab standards.
Yeah.
But by symptom findings in reality, they're low and they're going to feel it. The studies that are out there in the medical world, they're from the 90s. That's 35 years ago.
I remember the 90s.
And they actually support improvement in symptoms with replacement testosterone. So what's so interesting is the studies that show that it actually helps are 30 some years old.
Right.
But we haven't heard about it as much until more recently.
Yeah.
And I think there's a lot of medical practitioners and clinics around the country who have found that this makes a big difference.
Yeah. So at anything less than 500, it's possible to start feeling symptoms. And yet, if you were just following that lab range, you wouldn't start thinking about replacing until you got much, much lower.
Right.
Interesting.
Right.
Yeah.
Right.
So, I mean, it's tough that that's so controversial because it doesn't seem like it should be. Is there a downside to getting a man's testosterone at age 50 to what it was at 25? I mean, what is the downside if there is one?
Well, especially if they're less than 50 and they're less than their age, then the downside is not replacing it. There's not much downside at replacing it at age 50. We have to watch for a few things. There are some risk if you don't replace it, or things that happen with lower testosterone, and we have a slide on that. And this is also interesting because just naturally, as we think about men aging, these are the things that happen to us and that we know from our parents or our grandparents. And those are, as your testosterone goes down, your risk of diabetes is higher, metabolic syndrome, and that's a lot of that weight gain, just you don't feel good. Inflammation, hypertension goes up, atherosclerosis, or kind of plaques of the arteries or hardening of the arteries, stiffness, the insulin resistance changes, joint pain, joint aches. Those all lead to complications and even death.
Yeah.
And so it's if we don't replace it, we're facing those things.
Yeah. Is there a risk to replacing it? What should a man be concerned about if he's thinking about testosterone replacement?
So with trying to replace it, we want to keep them safe and stable. And so the things that we would do to prevent problems is keep them on a reasonable level of replacement, not going too high. Anytime anyone starts a hormone, the first year of being on any hormone, man or woman, there is a slightly higher risk of a clot, like 8 per 10,000, I
A
think.
blood clot.
Yeah, very slight. So we would say baby aspirin once a day. The PSA will rise a little bit typically. So we want to make sure that your PSA was normal when we start.
To begin with, yeah.
To begin with. You will see probably a rise in your lipids slightly. So we watch for that. And then if it is more common that if you're on a higher dose of testosterone, you could have an increase in your red blood cell count. Not that often, but something we have to check. So as long as we're following the safety parameters and trying to keep a man safe, we can replace them to an optimal level, which we try to replace to 1,000. That's a level of a 25, 30-year-old. Because we say, well, if we're going to replace them, why replace them to a 50-year-old's level?
Right.
Let's replace them to where they actually feel good. And we do a lot of pellets, and pellets are more stable, so they don't give you as many peaks and valleys. The injections, they give peaks and valleys, so it's much easier to go super high with an injection than a pellet.
That seems like a good place to pause, because we've got to talk about steroids that are being used by athletes. Everybody knows the controversy. They were using testosterone. They're using testosterone injections, and they're trying to get their numbers to crazy high numbers, aren't they?
Correct, right.
To build muscle artificially, to enhance athletic performance artificially. That's not what we're talking about here, but it's testosterone that they're using.
It is testosterone. And so by the injections, they can stack them, take them more frequently to get into the thousands.
Right.
And it does build muscle as we look at bodybuilders who use testosterone. It builds crazy muscle, but that's where the risks come in for safety.
And that's not what we're talking about, but they get lumped together.
Right. Yeah. And absolutely not what we're talking about. Yeah. But what we're talking about is feeling good again, where you can build muscle. You have the energy back, libido, erections, vitality, but not the level of a bodybuilder where you're going for super high levels.
Sure. Well, you mentioned the word pellets, so let's go with that. So what are all of the ways that you've got available to you to treat men with low testosterone? They've got symptoms. You confirm it with your lab studies. Now you're going to put this man on testosterone. What tools do you have available?
Well, the tools would be, in general, creams, gels, injections, or pellets.
Yeah.
So creams and gels are not as effective. They'll give a man at best 20% improvement over their baseline.
Okay.
That you put them on every day, you apply it every day, maybe twice a day.
And that number would go up there, and their blood would go up accordingly.
Right. And the way a cream works or a pill, you can't use a testosterone pill because it gets chewed up by the liver.
Sure.
So it gets degraded. But the creams or pellets or injections bypasses the liver, so it's able to get into the bloodstream.
Right.
And then it goes up immediately with the cream. In the first 4 hours, you're super high, actually. You're in the thousands. And then it starts to come down over the next hours until tomorrow morning.
Yeah.
And so they'll get a little boost of how they feel in the first part of that day. But by tomorrow morning, they're back down to about 20%, only 20% higher than where they were. So if they were at 200, for example, a 20% improvement is 240.
Yeah.
They won't be significantly higher.
Sure.
And injections are either once or twice a week. And the same thing, they'll go up, they'll boost up, and then it'll come down. So if it's a once-a-week injection, the first 3 or 4 days, you're on the way up. Yeah. But the last 3 to 4 days, you're feeling the symptoms of low testosterone again.
And then the pellets, which is probably odd for people to think of. You should probably explain exactly what pellets are.
So the pellets have also been around for about 30 years.
Oh, really?
And the pellets are they're a little bigger than a grain of rice, than a long grain of rice for men. And they are a dissolvable form that gets inserted under the skin. We use some lidocaine. We make a teeny wee little poke. They're kind of inside of a needle, so to speak. And then they go in under the skin, kind of in the buttock hip area.
Yeah.
And they then dissolve over the next 4 to 5 months.
Months, not days or
Months.
weeks, but
Right.
Yeah, but months.
So it's a nice stable level. The first 4 weeks, it's going up to where we want to shoot for about 1,000, and then it stays there for 4 to 5 months. So day and night, a man feels the testosterone effects. It's not going up and down. So it helps with sleep, helps with daytime. It just helps 24 hours. And the stability of the pellet is why it works so well.
And so you said about 3 to 4 months.
4 to 5 for men.
Well, 4 to 5 months. And then they would typically come back, have their level checked, check in on their symptoms, and then maybe replace.
If they like how they're feeling, we would just put another set in the other side.
I see. And then do men metabolize that differently? Will some man feel great for 6 months and another man maybe at 3 months he feels low again?
Usually not as much as 3 months, but you're right. Less than age 60 will metabolize faster than over age 60.
I see.
We factor in those things. And then a man who's exercising and lifting weights, for example, or a lot of cardio exercise will also metabolize faster. So we factor all those things in when we put them in to estimate this person and their lifestyle and what do we need to do to get them to feel optimal and hover around 1,000 roughly for the 4 or 5 months.
But they're going to feel something the next day.
After the pellet?
Yeah.
Usually I'd say the first week they're gonna start feeling something, but a lot of men might pass it off as, oh, I just had a good day today.
Right.
The second week, most men are saying, I like this. I hope it's the pellet.
Yeah.
And the third week, I've heard men say they feel like they can conquer the world. They love this, and they feel like they used to feel years ago.
Yeah, that's interesting. I mean, it's been such a hush-hush topic, it seems like, for so long. But I think increasingly men are learning, and probably because the viewers of this podcast, their spouses are telling them, you should get checked. Something is not right. You know, there's something wrong.
When that happens a lot, the wives will say, oh my gosh, this sounds like my husband. And they'll come in with him.
Yeah.
And then they'll come back and they'll say, wow, his mood is so much better.
Yeah.
His energy's better. Sexually is better.
Right.
His erections are stronger like they used to be. He just feels good. He's a nicer person to be around. And he feels the same. He feels wonderful.
I think our phones are going to blow off the hook tomorrow probably from from this. But yeah, I mean, that is interesting. We're OBGYNs, we're specialists in women's health care. Now, you've pursued additional training for the male hormone side. But aside from that, I mean, it's impossible not to consider their spouse's health and their spouse's behavior and how things are going when you're thinking about women's health, which is our obvious connection to it.
Right. And I wish I just learned this in the last year or so. This wasn't taught in med school. I had to go seek extra training because I used to give the regular prescriptions for women's hormones. And when I realized that I was hardly making a difference, like a drop in the bucket, to now where women and men are coming in saying, this has changed my life. The pellets have changed my life, changed my marriage, changed how we feel about each other, changed just the mood, the energy, how we relate to our kids. And a lot of people who are coming in for men are in their 40s, 50s, 60s.
Wow.
And it's also the time when many of our children graduate and they're out of the house.
Yeah.
So now you're left you've given your life for your kids. They've taken a lot of our life, right? And now like, oh, we're exhausted. Well, a lot of times it's actually hormonal related. And so we can make a difference.
Wow. Yeah, it sounds like it would make almost everybody feel better. But do some men in their 50s and 60s not experience these symptoms? I mean, this is not everybody. I guess we should be clear, because it is possible that you feel just fine.
It's absolutely possible, and
Yeah.
there's definitely some genetics to it and lifestyle. Yeah, I've seen men who are in their 60s. They're at 700 naturally.
Yeah.
So they
They feel
don't.
fine.
Yeah, they feel fine.
Now, what we mentioned a little bit earlier with estrogen and obesity. So, if a man is overweight, is he more likely to be symptomatic of low testosterone, even if the number is okay?
Yes, because with being overweight, you have a higher conversion of the cholesterol and fatty tissue to
To
estrogen.
estrogen.
So the most overweight men are going to have a low testosterone,
Wow.
and that then it becomes a continual cycle that
Mm.
they then can't self-regulate because now they have this ratio of higher estrogen to
Yeah.
testosterone for them. So then it's harder to lose weight, and then
Do you find that there's a fear on the man's part? Gosh, I'm overweight. I feel awful, but I'm overweight. If I take testosterone, I'll gain weight.
not on the men's part. Most of the time, when they're overweight, they're tired,
Mm.
they just want help,
Right.
and so I see the opposite with men. They usually are able to then lose weight.
After they start the testosterone.
Yeah, especially if they're severely overweight,
Mm.
being on testosterone and checking their thyroid and vitamin D,
Right.
then they're able now to finally build muscle, lose weight because they're more motivated, they have
Yeah.
more energy.
Wow. Yeah. And all of those other health parameters are going down for the obese man. He's getting less active.
Right.
He's gaining weight by the month.
Right.
He's not exercising as much. That raises risk of cardiovascular disease and all sorts of things.
Right.
And much of that, if not all of it, could be relieved or the direction changed with testosterone supplementation.
So another thing I forgot to mention is sugar cravings. So testosterone levels, when they're optimized, sugar cravings go way down.
Really?
So a lot of men and women say I'm not craving sugar like
Oh.
I used to, which then also belly fat
Right.
goes down.
Wow.
So there is a correlation with the diet and how they feel, and that's especially at nighttime after you're done for the day. If you're having sugar cravings and you're already on the couch,
You're going to gain weight.
right?
Yeah.
Yeah. But
It's hopeless.
this helps to take care of that.
Yeah, that's fascinating. So maybe walk us through from start to finish. Our viewers, probably a wife, a spouse watching us, she's going to say to her husband, you got to go see Dr. Cly and get your hormones checked. So a man's going to call or his spouse is going to call the office and get them an appointment. What happens in that first appointment?
So I got a slide I'll have you look at next here. So this slide, this is a questionnaire. And so this is called the ADAM questionnaire, and it's for men, and it is androgen deficiency in the aging male. You could probably Google it also. But I would say first, if you're a man or if you have a man or married to a man or have a man in your life, this is a questionnaire to think about. And women know this: decrease in libido, or do you have a lack of energy? Do you have a decrease in strength? Have you lost height? Have you noticed a decrease in enjoyment of life?
Mm.
Are you sad and grumpy? Are erections less strong? Do you not want to play sports or you've deteriorated in your ability to play sports? Are you falling asleep after dinner? That's a big one for wives. And how about at work? Are you deteriorating? So if you answer these questions, and if you have questions to any three questions is yes, for sure you should come in for an evaluation because there's a good chance your testosterone is low.
So what's that initial evaluation look like when they come to the office? What happens?
We talk to them, find out what symptoms they're having,
Sure.
where they used to be. So the question and answer, and then we do a lab evaluation looking at the thyroid.
Right, all those hormones we talked
Right.
about.
We look at those.
So they get that done, they talk, they have their blood drawn, they leave, then they come back.
Come back, and then usually we talk to them at that first visit about if you're low,
Yeah,
or if we think it looks like you're low, what are you interested in?
sure.
And when they come back, we already kind of have an idea, but frequently when they come back, we'll do an insertion of pellets.
Mm. And how long does that take?
The pellet insertion itself, 10 minutes.
Yeah, so you don't have to take the day off to get pellets in.
Oh, no.
Yeah.
And then you leave, you're back to normal. So you can walk, you can play golf, you can
Go back to work.
We just say, don't do leg exercises for 4 or 5 days.
Sure.
Just so you're not working that area
Awesome.
in the buttock area.
Yeah.
Yeah.
And so they do that, they go home, they feel like $1 million. They come back when?
The first time your body will probably metabolize it. So the first pellet you'll get, we want to check a 4-week level
Mm.
to see how you're doing with the first one. And then we do a 5-week boost pellet if you need it. And so then after that, we do labs on men again at about 4.5 months, see where they're at. And then if they like it, about 5 months, we do another set of pellets. And usually we have it dialed in based on how they did the first 4 to 5 months. So the next set, they don't usually need that boost.
Yeah.
It's just
So,
4 to 5
and this is
months.
going to be a longitudinal relationship. You're going to see them on a regular basis. You are one of our nurse practitioners. Check in on their symptoms, check in on their blood levels,
Right.
check in on what dose they're taking
Right.
For a long term.
Right. I'd say most men really like the way they feel, so they just keep coming back, and you can keep doing it as long as you want to,
Yeah.
just within the safety parameters.
Now, as part of that, you're very likely to find thyroid dysfunction as well. Do you see both in men, that you're attacking both of them at the same time?
Frequently.
Yeah.
And so with the similar labs, we do those first, and then we start Armor Thyroid, WP Thyroid, and that's it. Every morning you take that, and then we check your levels at about 4 weeks, and then we check them again 4 or 5 months later. And that makes a difference also.
It seems like, as I'm listening to you, I'm thinking of kind of a special circumstance we should probably talk about, and that is the man and his wife who are trying to conceive, and there may be male factor infertility, maybe erectile dysfunction to the point they can't be intimate. So he's thinking, well, I'll get these pellets that Dr. Clyde's talking about, and it'll solve that problem. But it can create another problem. It can drive their sperm count parameters down. And I know I've sent several patients to you in that setting, and you have to just sort of titrate on an individual basis what dose will make them feel better without destroying their sperm count. But we don't want men to rush and start taking testosterone or testosterone supplements of any kind if they're struggling with fertility until we've had a chance to do that evaluation.
You're exactly right. And there's some other things, medicines or things we can use to try to boost their testosterone, not affect their sperm count.
Yeah.
And then what I've said to a couple patients recently is, as soon as your wife's pregnant, then we're going to do the pellets, because then we get you feeling 100%.
Sure.
Until then, we can make a difference and get you feeling better.
Especially if low testosterone may be a component of the infertility.
Right, exactly.
Yeah.
Exactly.
Yeah, that's fascinating. And so we should probably talk a little bit about cost, right? So the pellets are a compounded medication. You mentioned creams and some gels. Those are typically commercially available at pharmacies. The visit to see somebody like you or one of our nurse practitioners, that's covered by insurance. The pellets themselves are not. So give viewers a sense of what kind of financial obligation are we talking about?
Yeah, the visits covered, the labs are covered through the insurance.
Through insurance, that's right. Yeah.
And then the creams or gels are about $60 a month at the pharmacy. Insurance companies don't pay for testosterone creams.
Right.
And the pellets are about $100 a month, roughly. So
depending on the dose, probably.
for men, we right now do $600
Sure.
for men's pellets. So if 600, if it lasts 5 months, is maybe a little more than
I see.
100 a month.
Right.
The difference is the way you feel. So creams, you'll feel 20%. You'll have a 20% boost.
Sure.
Pellets, 100% better. And so it's an exponential difference on how good you feel. And we are underpricing our pellets. If you ask me, I think we should raise our pricing a little bit. But right now we're a little bit lower because it's not about making money. We want to service and help people. But in the community, we're on the lower side right now of pellets.
And I find on social media, it's everywhere. Testosterone. We didn't just think of this, right? It's everywhere in social media. And I find a lot of those clinics do not take insurance for the visit
At all.
And so not only is the testosterone more expensive, but you're going to pay for those visits and be more expensive.
Yeah. And they're doing injections. So most of them are doing injections.
So you're coming back regularly.
You're coming back regularly. And so that it's several, usually a man's consult and testosterone injections, you're in the 700 or more range. And then you don't have the same effectiveness of the pellets.
Yeah. And insurance is not covering any of that.
Right.
Yeah.
None of it.
Yeah. With us, because we bill through insurance, it's going to be much more affordable, I would think, for most men.
Right.
Yeah.
And most guys say the cost isn't a factor when
Once they feel good.
once they feel good. I've been looking for this for years.
Yeah. So we've gone through all of the symptoms of both thyroid, vitamin D, and low testosterone. Well, what do you find is the biggest obstacle? Because I don't really understand why there's not 75 men waiting out in front of your door tomorrow. There might be after this podcast.
No,
But,
gotcha. I think some of it is that we're women's health.
oh, sure.
So that's maybe some of it.
Maybe a reluctance to come.
Some reluctance. I think men typically we're busier, and I think we're also a little more afraid of the unknown. Like
Yeah.
we would rather not have that uncertainty of what should we do.
Yeah.
So it does help when our wives or the women in our life say, "I think you need this."
Yeah.
They kind of checked it out a little bit for us. But
Sure.
that I think helps a lot.
Yeah. So it seems like the takeaways is be not afraid. You're supposed to feel better. If you don't feel good, you don't have to not feel good.
Right.
It may be your thyroid. It may be your testosterone. And we can fix that. There's
Right.
just no reason to struggle.
Right. And optimal levels are different than the normal lab levels. So
Good point.
most docs will say your labs are normal. Or if you look on your online chart, like my chart, for
Yeah.
example, it does a really nice job of telling you if you're in the green or the red.
Yeah.
So you see that and you're like, oh,
I'm fine.
I'm fine. I don't know why I don't feel good, but my labs are fine. But that's actually in the green, in the middle, and the optimal is where we want to get you.
Yeah. Maybe the take home from that is don't get your testosterone checked at just any lab with any provider. It needs to be somebody that's got expertise like you do in replacement issues.
Yeah, and thank you. And expounding on that more, your family doctor, if your family doctor or your regular OBGYN doesn't do specialty hormones, they are not going to be able to give you an answer.
Sure.
I didn't understand that until I went and did the training over a year ago.
Sure.
I just didn't know what I didn't know. So a lot of people feel lousy, but they said, my doctor said I'm fine. Your doctor's not doing anything wrong.
Right.
They just don't have that education. So
Sure.
seek out several of us or other clinics in town who specialize in hormones.
Yeah. That seems like a good place to end it. It's been a great discussion. I think we've probably potentially changed a lot of men's lives
Hope so.
in just a few minutes. Yeah, viewers, thanks again for joining us for another episode of All Things Women's Health on men's health today. But it certainly affects women's health, as we talked about. What did we leave out? What would you like to know more about? Comment below. We'd love to know your thoughts on this episode. Are there other topics that you would like to hear me cover? I'd love to know those ideas as well. You can reach us a lot of ways. You can contact our office at 260-222-7401 is an easy way to get this conversation started. Dr. Clyde, be happy to see you and or your spouse to talk about all matters hormone, especially testosterone and men. Thanks again for joining us. I'll be back again soon with another episode of All Things Women's Health.